The importance of regular health checkups and screenings for common diseases and conditions. One of the best ways to stay healthy at any age is to get regular medical and dental checkups. These visits can help you prevent diseases, catch problems early, and improve your quality of life. In this section, we will explain what are some common health checkups and screenings that you should get in your 30s, 40s, and 50s, and why they are important for your health. Screenings are medical tests that doctors use to check for diseases and health conditions before you have any signs or symptoms. Screenings can help find problems early on, when they may be easier to treat. Depending on your age, sex, and medical history, you may need to be screened for things like certain types of cancer, such as breast, cervical, colorectal, prostate, and skin cancer. Cancer screening can help detect cancer at an early stage, when it is more likely to be cured or controlled. Some cancer screening tests include mammograms, Pap tests, colonoscopies, prostate-specific antigen (PSA) tests, and skin exams. High blood pressure or high cholesterol. High blood pressure and high cholesterol are risk factors for heart disease and stroke, which are leading causes of death in the United States. High blood pressure and high cholesterol usually do not cause any symptoms, so screening can help you find out if you have these conditions and take steps to lower your risk. Some screening tests for high blood pressure and high cholesterol include blood pressure measurements and blood tests. Diabetes or prediabetes. Diabetes is a condition that affects how your body uses sugar, glucose. Prediabetes is a condition where your blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. Both diabetes and prediabetes can increase your risk of heart disease, kidney disease, nerve damage, eye problems, and other complications. Diabetes and prediabetes often do not cause any symptoms, so screening can help you find out if you have these conditions and take steps to prevent or manage them. Some screening tests for diabetes or prediabetes include blood tests such as fasting plasma glucose test or hemoglobin A1C test. Osteoporosis or weak bones. Osteoporosis is a condition that causes your bones to become thin and brittle, making them more likely to break. Osteoporosis can affect anyone, but it is more common in older adults, especially women after menopause. Osteoporosis can cause fractures, pain, disability, and loss of independence. Osteoporosis often does not cause any symptoms until a bone breaks, so screening can help you find out if you have low bone density and take steps to prevent or treat it. Some screening tests for osteoporosis include bone mineral density tests, such as dual energy X-ray absorptiometry (DXA) scan. STDs, sexually transmitted diseases. STDs are infections that you can get from having sex with someone who has the infection. Some common STDs include chlamydia, gonorrhea, syphilis, herpes, human papillomavirus, HPV, hepatitis B, hepatitis C, and HIV, human immunodeficiency virus. STDs can cause serious health problems such as pelvic inflammatory disease, PID, infertility, cancer, liver damage, and AIDS, acquired immunodeficiency syndrome. STDs often do not cause any symptoms until they cause complications or spread to others, so screening can help you find out if you have an STD and get treatment to prevent further harm. Some screening tests for STDs include urine tests, swab tests, blood tests, or physical exams. Mental health conditions like depression. Depression is a common but serious mood disorder that affects how you feel, think, and act. Depression can cause persistent sadness, loss of interest in activities you used to enjoy, changes in appetite or weight, trouble sleeping or sleeping too much, fatigue or lack of energy, feelings of worthlessness or guilt, difficulty concentrating or making decisions, and thoughts of death or suicide. Depression can affect anyone at any age and can interfere with your daily life and relationships. Depression often goes undiagnosed or untreated because people may not recognize the signs or seek help due to stigma or shame. Screening can help you find out if you have depression and get treatment to improve your mood and well-being. Some screening tests for depression include questionnaires such as the Patient Health Questionnaire, PHQ-9, or the Beck Depression Inventory, BDI. Getting regular checkups and screenings is one of the most important things you can do for your health at any age. However, screening recommendations may vary depending on your personal risk factors such as family history, lifestyle habits, ethnic background, or previous test results. Therefore, it is important to talk to your doctor about which screenings are right for you and how often you should get them. By getting screened regularly, you can take charge of your health and prevent or treat common diseases and conditions that may affect your quality of life. The specific tests and exams that are recommended for each age group, 30s, 40s, and 50s, and how often they should be done as you age. Your health needs change, and so do the preventive measures you should take to stay healthy. In this section, we will talk about the specific tests and exams that are recommended for each age group, 30s, 40s, and 50s, and how often they should be done. If you are in your 30s, you should get the following tests and exams: a Pap smear and an HPV test every 5 years to check for cervical cancer and HPV infection. HPV is a virus that can cause genital warts, and some strains may cause cervical cancer. If you prefer, you can also get a Pap smear alone every 3 years. A depression screening at least once to assess your mental health. A healthcare provider will ask you some questions about your mood, interest, appetite, sleep, and other aspects of your well-being. A blood pressure check at least once every 3 to 5 years, or more often if you have risk factors for hypertension. High blood pressure can increase your risk of heart disease, stroke, and kidney problems. A cholesterol test every 4 to 6 years, or more often if you have heart disease, diabetes, a family history of heart disease, or other risk factors. High cholesterol can clog your arteries and lead to heart attacks and strokes. A dental exam every 6 months to check for cavities, gum disease, and oral cancer. You should also brush your teeth twice a day and floss daily to prevent plaque buildup. A skin exam once a year to look for any changes in your moles, freckles, or other marks that could indicate skin cancer. You should also use sunscreen and avoid tanning beds to protect your skin from sun damage. A sexually transmitted disease, STD, screening at least once a year if you are sexually active and have multiple partners or a new partner. You should get tested for chlamydia, gonorrhea, syphilis, and HIV. Some STDs can cause infertility, pelvic inflammatory disease, cancer, or other complications if left untreated. If you are in your 40s, you should continue with the tests and exams started in your 30s and add the following: a colonoscopy every 10 years to check for colon cancer and polyps. Polyps are growths that can turn into cancer over time. You may need to get a colonoscopy more often if you have a family history of colon cancer or other risk factors. A mammogram every year to check for breast cancer if you are a woman. A mammogram is an X-ray of your breasts that can detect tumors or abnormal changes in breast tissue. You may need to start mammograms earlier or get them more often if you have a family history of breast cancer or other risk factors. A prostate screening every year if you are a man. A prostate screening involves a blood test called PSA, prostate-specific antigen, that measures the level of a protein produced by the prostate gland. A high PSA level may indicate prostate cancer or other prostate problems. You may also need a digital rectal exam, DRE, where a healthcare provider inserts a finger into your rectum to feel your prostate for any lumps or abnormalities. A bone density test at least once to check for osteoporosis if you are a woman. Osteoporosis is a condition where your bones become weak and brittle and can break easily. You may need to get a bone density test more often if you have a family history of osteoporosis or other risk factors. If you are in your 50s, you should continue with the tests and exams started in your 40s and add the following: a lung cancer screening every year if you are a current smoker or have quit smoking within the past 15 years. A lung cancer screening involves a low-dose CT scan of your chest that can detect lung nodules or tumors that may be cancerous. You may need to get a lung cancer screening more often if you have a family history of lung cancer or other risk factors. A diabetes screening every 3 years if you have high blood pressure, high cholesterol, obesity, or other risk factors for diabetes. Diabetes is a condition where your body cannot properly use sugar for energy and can cause damage to your eyes, kidneys, nerves, and blood vessels. A diabetes screening involves a blood test that measures your blood sugar level after fasting for 8 hours. These are some of the tests and exams that are recommended for each age group, 30s, 40s, and 50s, and how often they should be done. However, these are general guidelines, and your healthcare provider may suggest different tests or frequencies based on your personal health history, family history, and lifestyle factors. Therefore, it is important to talk to your healthcare provider about what tests and exams are right for you and when you should get them done. The lifestyle habits and choices that can help prevent or manage chronic diseases and improve overall well-being are: eating healthy. A balanced, healthy dietary pattern includes a variety of fruits, vegetables, whole grains, lean protein, and low-fat dairy products, and limits added sugars, saturated fats, and sodium. Eating plant-based foods helps reduce diabetes, heart disease, and cancer risk. Getting regular physical activity. Physical activity can help prevent, delay, or manage chronic diseases such as heart disease, cancer, diabetes, and obesity. Aim for moderate intensity physical activity, like brisk walking or gardening, for at least 150 minutes a week, with muscle strengthening activities 2 days a week. Avoiding drinking too much alcohol. Excessive drinking can lead to high blood pressure, various cancers, heart disease, stroke, and liver disease. By not drinking too much, you can reduce these health risks. The recommended limit is no more than 1 drink per day for women and 2 drinks per day for men. Getting screened. To prevent chronic diseases or catch them early, visit your doctor and dentist regularly for preventive services such as cancer screening tests, prediabetes and diabetes testing, oral health checkups, and blood pressure monitoring. These screenings can help you detect any problems before they become serious and take appropriate actions to treat them. Taking care of your teeth. Oral diseases can cause pain and disability, and increase the risk of other chronic diseases such as diabetes and heart disease. To prevent oral problems, drink fluoridated water, brush with fluoride toothpaste twice a day, floss daily, and visit your dentist at least once a year. Getting enough sleep. Insufficient sleep has been linked to the development and poor management of diabetes, heart disease, obesity, and depression. Adults should get at least 7 hours of sleep daily. To improve your sleep quality, avoid caffeine, alcohol, nicotine, and large meals before bedtime. Keep your bedroom dark, quiet, and comfortable, and stick to a regular sleep schedule. Knowing your family history. If you have a family history of a chronic disease such as cancer, heart disease, diabetes, or osteoporosis, you may be more likely to develop the disease yourself. Share your family health history with your doctor, who can help you take steps to prevent these conditions or catch them early. You can also take genetic tests to find out your risk of certain inherited diseases.